Examples of this one. Has anybody ever seen Fatal Attraction? You remember that old movie? Do you remember Glenn Close in that movie? Okay, she probably had borderline personality disorder in that movie. So think of her when I talk about some of these. The other one is Girl Interrupted. There's a show with Angelina Jolie in it. She had borderline personality disorder as well. So think of, and I didn't see that movie. I need to see it, but I haven't seen it. Now Glenn Close, yeah, certainly I would agree with Vicki on this one that she had borderline personality disorder. Incidentally, and I don't think it's any. I mean, Angelina Jolie actually has borderline personality disorder. She came out and said that a while back, and so some of the things you hear about her, and when you listen to some of these symptoms, you'll be able to kind of relate that to her. But what is borderline personality disorder? The name is kind of weird. You kind of think to yourself now, where did that come from? What does that mean? Borderline personality disorder. It came from the old days where they they thought that, and maybe true. I mean, it's sort of still true, I think. But these folks there's like a line between neurosis, which is like anxiety and depression, and psychosis, which is where you sort of hear things and see things, hallucinate, and have delusions. Okay, so the borderline personality disorder folks are kind of walk this line right down the middle, and sometimes lean a little towards neurosis, sometimes towards psychosis, and so that borderline that's where that came from. I don't think it's a real good description. It doesn't really describe what it is to people. It should be some sort of mood regulation disorder or something like that. But basically what it is, it's a pattern of unstable relationships. These folks really have a heck of a time in relationships. And I'll tell you why in a second. But they also have a poor sense of identity and self-image. They can't control their emotions very well, and they're very, very, very impulsive, severely impulsive. They're extremely afraid of being abandoned by other people. And sometimes it's because they have been over and over again. By parents. Remember we talked about not bonding with your parents, or your parents not being available to you, that kind of thing. It seems to be that when that happens in a boy, and they're impulsive aggressive already from their temperament, they might be more likely to be antisocial. But if you're a girl and you're impulsive aggressive, and then you don't have much bonding and all that trouble, that stuff happens, you're more likely to become borderline personality, have borderline personality disorder. The reason that's not 100% is because there are some folks who have borderline personality disorder and they have not had a childhood history of neglect or abuse or anything like that. So, but a lot have. I think it's, if I'm not mistaken, it's 70% have. So it's quite a few of them. So they're so afraid of abandonment by other people that they cling real tightly to someone, to whoever they're with. Let's say it's a significant other or something. So they're afraid to lose them, so they cling real tight. But then they start feeling like they're going to abandon me. I just know they are. So they push them away. Okay? And they push them away because they want to be the person in control of being abandoned, right? They don't want to just all of a sudden be abandoned and have it strike them, off guard. So they push the person away, saying, "I know you're going to abandon me anyway. Just get away now." Of course, the other person's going, "What happened? Just came out of the blue. I didn't see that coming." And it's a roller coaster for them. As I said, they tend to have experienced a lot of rejection and abandonment in the past, and that's why, and that may be where that comes from. They become severely angry when they think somebody might be about to abandon them. So, and some of this stuff is they kind of their thoughts get the better of them. So they call to get a hold of the person because they were supposed to go out that night, and the person doesn't answer the phone. So right away, oh, they're going to blow me off. They're not going to be around. They don't want to hang around with me. They're not going to be there tonight. They're abandoning me, and they go completely off the deep end with that. Well, the person was in the shower and couldn't get to the phone or something like that. So it's common for things like that to happen. They use extreme measures to keep others close. Like I said, clinging to them. The extreme measures can be things like cutting on themselves, threatening to kill themselves, or actually doing some type of suicide gesture. Again, they don't typically want to die, and when they do die, it's because they kind of accidentally die. I mean, they may think, let's say they may think, oh, I'm going to overdose on Tylenol. It's not going to hurt me, kind of thing. Well, as you know, Tylenol can kill you if you overdose on it, but they didn't realize it, so they were doing it more to get some attention or to get some reaction from somebody. You remember the histrionic folks where I talked about they get real close real quick in a relationship? These folks do the same thing. They get real close real quick with somebody. and they share intimate details. They don't. You guys have heard of boundaries, right? Like we all have certain boundaries, which socially it's just not appropriate. When you first meet somebody, you start talking about your sex life or something like that. Okay, these folks do that. It's the kind of stuff that they do. There's no boundary there. Another example, you know how there's sort of rules about when you're a therapist or a psychiatrist. You don't hug patients, you don't go out and have a drink with your patient or things like that, right? Well, these folks, that's what they want, right? They get in first session, can I have a hug? First session, hey, can we go out for a drink sometime? They want to get extremely close, and that's the only way they know how to do it. They also tend to see other people, and this is another thing that kind of drives other folks, kind of makes them crazy. They see people as either all good or all bad. So a common one is if you're a therapist, or like for me, for instance, they'll come to see me in the first session. Hey, you're the best doctor I've ever had, kind of thing. Maybe 3-4 sessions later, and I don't give them medicine they want to have, or let's say I'm late, 15 minutes late on the appointment or something like that, and all of a sudden I'm scum of the earth. I don't want to ever see that doctor again. I'm not coming back to him. And it's the same thing with it's not just with doctors. It's with anybody. If you're their friend. You're their best friend in the world. You can do no wrong. That's called idealization. They sort of idealize you. But then all of a sudden, again, you don't answer the phone when you're supposed to go out that night or something, and then you're scum of the earth. You're not going to have anything to do with you anymore, that kind of thing. So so it's extreme. You see how that's kind of extreme? The other thing is they tend to look at everything as black or white. There's no in between. That kind of fits with all the other stuff I just talked about, right? So people, they're all either all good or all bad, no in between. Everything is that way. Every issue in their lives, it's either all good or it's all bad. There's no in between, no gray. It's black or white. They don't have a very good sense of identity or self. So what does that mean? Like if I were to ask you guys, describe yourself to me. Some of you would say I'm a mom. Some would say I'm a wife. Some would say I'm a college student or whatever. You describe yourselves in some way. These folks kind of say, I don't know. I don't know who I am. They don't really have a good picture of themselves. They tend to suddenly shift their goals, values, or opinions, and even their sexual identity. So because their identity is messed up, it can affect sexual identity as well. So sometimes these folks, they'll be heterosexual, the next time they'll be homosexual, and sometimes bisexual, and so they kind of flip all over. And it's really their attempt to try to figure out who they are, and they can't figure that out. It's kind of sad in a way. And as a matter of fact, sometimes their identity problems are so bad that they don't even feel like they exist. Like sometimes, this may be a little foreign to a lot of you guys, but how do we know we exist? These folks just feel like they're invisible sometimes, to other people and also to themselves. And that can lead to things like cutting on themselves, and we'll talk about that in a minute as to what would that have to do with it. The impulsivity is severe, and I told you that earlier, but it's things like, again, suicidal acts, impulsively just acting on suicide. Like the person didn't answer the phone because they were in the shower, like I said, and this person immediately goes to cut themselves. They gamble, they spend, they binge eat, abuse drugs and alcohol, they have unsafe sexual practices, and they drive real recklessly. You hear some of the symptoms of being sort of similar with antisocial personality. Some of this impulsive stuff is kind of similar. And there was an Indianapolis Star on Sunday had a little article about impulsivity and impulse control problems, and there have been some studies on where that may be in the brain and how it can affect really how long we live, which seems kind of rational to me. If you're impulsive, you do reckless things, right? And you're not going to live as long, probably. They tend to have chronic suicidal thoughts, threats, gestures, or self-mutilating behavior. The self-mutilating is like cutting on themselves. So I don't know if anybody's ever known anybody that's cut on themselves before, but some people do that as an attempted suicide, and some people really want to die when they do it, and some people don't necessarily want to die, but and maybe don't even have thoughts of death. Maybe there's other reasons people can do that. Like I told you, some of these folks don't, when they have borderline personality, don't have an identity, and they don't feel real, and so they'll cut on themselves to see themselves bleed, and okay, I know I'm real. It's sort of like sticking yourself with a pin to make sure you're awake,